Elective surgery may be cancelled due to the strain placed on the health system by the Omicron outbreak. Doctors say it could have been avoided. Many other essential services continue to be disrupted, with numerous workers off sick or isolating.
As cases continue to climb, more cracks in the health system are showing. The Premier today flagging elective surgeries may soon be cancelled.
During the Delta outbreak, and the year before, we suspended elective surgery for a period of time. That is certainly something we're looking at now.
Doctors say this could have been avoided.
It shouldn't be something we can turn on and turn off, because this isn't unnecessary surgery. Just because we call it elective surgery, this is the kind of lives and health of thousands of people in New South Wales.
Testing rules have changed again. Those who've had a positive rapid test no longer being told to confirm with a PCR test.
I'm here for nothing. I mean, look, we've made it this far in the line.
The amount of false positives you get, false positives and false negatives you get from rapid tests doesn't actually seem like the right thing to do.
But it had the intended effect, with some testing lines the shortest they've been in weeks. Other essential services are still struggling, with supply chains hit hard.
We're getting reports from right across the industry, from the ports to the centre of trucking, and are starting to emerge in parcels now, that between 25 and 50% of workforces are reporting absent on any one day.
There are almost 35,000 new cases. More than 1,600 people are in hospital, with 131 in intensive care. There were 6 deaths, including a man in his 20s. James Condilios was fully vaccinated with no underlying health conditions. He was remembered by friends on social media who said his death is a reminder that COVID can affect anyone in the community.
More than 6% of people in their 20s in New South Wales have had a positive PCR test in the last 4 weeks, and that number is rising sharply.
It is unlikely that young people without underlying medical conditions are going to get particularly sick, but it's not an impossibility.
Encouraging people to be alert but not alarmed. Kathleen, Calderwood, ABC News, Sydney.
With school back in just a few weeks, parents are becoming anxious about booking their kids in for vaccinations. 5 to 11-year-olds can get the jab from next week, but some parents haven't been able to get a spot yet. Health and education officials say they're working on a safety plan.
School may be out, but Melissa Wilson is already fearing for her daughter when classes resume next month.
Scared, worried, concerned for her health.
She hasn't been able to book in her Year 1 student, Arabella, for a COVID vaccination, despite bookings opening weeks ago.
They keep telling me to take responsibility for my own health in COVID and that of my family. But I can't get tested, you can't get boosters, and you can't get the kids vaccinated.
It comes as thousands of children are eligible to be vaccinated. From Monday, 5 to 11-year-olds can get the Pfizer vaccine. It'll be a third of the strength of an adult dose. They'll receive 2 jabs, 8 weeks apart.
The thing about children is that they're very resilient. They have tremendous immunity innately, immediately to COVID. So 1 dose of vaccination in a child is highly protective.
You good? Pleased to be back?
Health and education officials are now working on a safety plan to ensure students return on the first day of term. And some schools hope that's the same for teachers.
We can't just put the hand out the window and pull in a teacher. But we're like any other business. My local coffee shop, advertising, kebab shop, all want staff.
Staff shortages has prompted the Teachers' Union to seek an urgent meeting with the Education Department, hoping to avoid last year's disruptions.
We were averaging about 40 or 45 cases a day in schools across the state. That was at a time when the infection rates were but a fraction of what they are today.
We don't want the mess of public hospitals to be extended into public education.
Like most industries, schools will need to figure out how to remain operational during the Omicron wave. But the holidays have bought teachers and principals time. They'll have 3 weeks before children return to the playground.
We will be able to guarantee a level of safety, a level of learning and a level of security.
A level of security, hoping to bring some comfort to parents. Nakari, Thorpe, ABC News, Sydney.
Archibald Prize winner Craig Ruddy has died from complications due to COVID in northern New South Wales. A post on his Facebook page says the 53-year-old died peacefully in his partner's arms at home in Byron Bay. Ruddy's charcoal drawing of the late David Gulpilil won the prestigious Archibald Prize in 2004. And more recently, his portrait of Bruce Pascoe was also an Archibald finalist in 2020.
Obviously terrible news because Craig was such a quiet, gentle person, one of the most decent and dignified people you're going to meet. So that gentleness is a great loss to the world.
Mr Ruddy and his partner Roberto tested positive to the virus a few weeks ago.